Hi everybody, good morning, good afternoon, good evening, wherever you're watching me from. So this morning we're going to be talking about HIV prevention today. So when we talk about prevention, we're not talking about those that are already infected with HIV. We're talking about those that do not have it yet but are likely to have it, and those are people, that are not abstaining from sex. If you're not married, we're talking about persons who are not faithful to their spouses if you're married, and we're talking about persons who are already infected but they have partners that are not infected and are not using condoms. I know that you've heard of the ABC thing that was going on years ago. I don't really hear of it anymore, where A stands for abstinence, B stands for be faithful to your partner, and then C stands for the use of condoms. But now we have the D. The D talks about the use of medicines, that's drugs that are formulated, to prevent you from being infected with HIV and AIDS, and they are known as pre-exposure prophylaxis. My primary focus is to talk about the drugs that are available for prevention, especially for those that do not have HIV and AIDS, yes, but are practicing or are involved in very unsafe practices, like I've mentioned, not abstaining from sex if they are not married, not being faithful to their partners if they are married, and those that have HIV and AIDS but have partners that do not have HIV and AIDS and are not using condoms so as to help their partners. So there are drugs for use that are available for free in Nigeria and in other parts of the world. But there's a new one that I'm not sure has gotten to Nigeria yet, but that I just wanted to talk about here and inform you so that you have an idea of what it is. So the ones that are already available in Nigeria, right? Those ones are tablets and you have to take them every day, and we have people complaining of, oh, I'm tired of taking this medication every day. Of course, who won't be tired? Even me taking paracetamol for like 3 days, I'm already tired. This new medicine is an injectable and would only be taken twice in a year. That's every 6 months you take it. It's not a tablet, it's an injection. It's easy, people can easily adhere, as opposed to taking tablets every single day. But the challenge is it costs over 40,000 US dollars. How many persons who are not infected with HIV and AIDS but want to prevent themselves from getting it can actually afford this? So it's quite very expensive. Not just expensive, but it's not widely available. Like, it's not widely available to the marginalized population, the persons that really do need these medicines. And I can understand that with the pharmaceutical company that produced it, because a lot has gone into the studies, a lot has gone into the, procurement of materials to actually develop this particular medication. So now the choice is still yours. Like I would always say, your health is your responsibility. If you do not already have HIV and AIDS, now is the time to abstain. Now is the time to be faithful to your partner. Now is the time, to use condoms if you cannot abstain and if you cannot be faithful to your partner. Another challenge is that it is not available to all. So you would not want to put yourself in harm's way. If you do not already have HIV and AIDS, do your best not to get it, because it is quite expensive, whether you are preventing or you are treating. I just came to, remind us that there's still a way that you can prevent HIV and AIDS without spending $40,000 per year. Just abstain. Be faithful to your partner if you're married. Abstain if you're single. Be faithful to your partner if you're married. And don't forget to use condom if you're already infected and your partner doesn't have HIV and AIDS. HIV and AIDS is preventable. Choose your own way of preventing. The choice is yours. Take your health more seriously. Until I come your way again.